Lung 2 is in the centre of the deltoid pectoral triangle. To find the deltoid pectoral triangle, find the inferior border of the clavicle, the superior border of pectoralis major, and the medial border of the deltoid. Just in the centre of that triangle. Stomach 18 is in the 5th intercostal space, 4 sun lateral from the midline, at the root of the breast. Ren 17 is on the anterior midline, level with the 4th intercostal space. Liver 14 is 4 sun lateral to the midline in the 6th intercostal space. When you locate this point, make sure you are in the intercostal space, not on the rib. Stomach 15 is in the 2nd intercostal space, 4 sun lateral from the midline. Stomach 20 is 2 sun lateral to the midline, 5 sun superior to the centre of the umbilicus at the level of Ren 13. Stomach 19 is 2 sun lateral to the midline at the level of Ren 14, which is 6 sun superior to the centre of the umbilicus. Spleen 14 is just superior to Ren 6, 4 sun lateral to the midline.
Large intestine 18 is located on the side of the neck on a contour with a laryngeal prominence. It's in between the 2 bellies of the sternocleidomastoid. To bring the 2 bellies into relief, have the person turn their head against resistance. It becomes quite easy to see the sternal and the clavicular bellies of this muscle. Locate your point in between the 2 bellies and then have them relax their neck again. Gallbladder 8 is located 1 sun directly superior to the apex of the ear. Frequently you'll find a nice groove in the bone just at this point.
Large intestine 4, you're going to find the length of the 2nd metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the 1st and 2nd metacarpals, nearer to the 2nd than the 1st in the muscle. Large intestine 13 is 3 sun superior to large intestine 11. It's between the lateral borders of biceps brachii and the shaft of the humerus. If you divide the distance between the anterior axillary fold and large intestine 11 into thirds, the point just lies there. Sangel 10 is located 1 sun superior to the tip of the olecranon process of the elbow. The point is found with the arm flexed and the hand supinated.
Lung 9 is located on the lateral aspect of the wrist flexure, in between the radius, the scaphoid, which is one of the carpal bones, the radial artery, and the tendon of abductor pollicis longus, which is this big tendon that can pull the thumb out. So find the dip between all those three landmarks and the radial artery and mark your point there. Lung 6 is located 7 cm proximal on a line from lung 9 to lung 5.
Small intestine 1 at the ulnar nail point of the little finger. I'm going to feel for where the flare of the bone is, look at where the nail bed is, look at where the ulnar and the proximal borders meet, put my point in, and there it is. Large intestine 2 is on the radial aspect of the index finger. It's just distal to the second metacarpal joint. It's much better to locate this point with the fingers loosely flexed. Pericardium 4 is on the flexed aspect of the forearm, on a line connecting pericardium 7 with pericardium 3. It's 5 cm proximal to pericardium 7. In between these two tendons, palmaris longus and flexor carpi radialis. As you get to this point, the tendons start to go deeper within the body, so maybe a little bit more difficult to palpate, but remember you're going on a line from pericardium 7 to pericardium 3 to help you. Kidney 1 is on the sole of the foot, between the second and third metatarsals, approximately 1/3 of the distance between the base of the second toe and the heel. It falls into a depression when the foot is plantar flexed. Thank you.
Kidney 3 is located in the medial aspect of the ankle. It's on a level with the prominence of the medial malleolus, in between the posterior border of the malleolus and the anterior border of the Achilles tendon, the tendocalcaneus. Palpate for the deepest dip and mark your kidney 3 there. Spleen 5 is located in a depression which is anterior and inferior to the medial malleolus. Trace along the anterior border of the malleolus and the inferior border, and then palpate whilst you articulate the foot. Feel for a nice dip. Spleen 5 is in that dip.